I want to bring in NBC News medical contributor Dr. Bhadelia. She's an infectious diseases physician and the director of Boston University's Center for Emerging Infectious Diseases Policy and Research. Dr. Bhadelia, good morning. It's good to see you.
Good morning, Allie.
So listen, we are not where we were at the very beginning of this pandemic. You know, we have vaccines, we have treatments now for COVID. There are things that are different. But I think to a lot of people, this feels, even psychologically, and in some of the numbers we're seeing too, like we are right back where we were a year and a half ago. Is this winter surge going to be as bad as what we saw last year? I think for a lot of folks, it feels like deja vu. Here we are, Christmas time all over again, talking about maybe not being able to see family members, talking about having to change our plans yet again.
Yeah, Hallie, let me start with that. We are not at square one, but there are new challenges. We have the tools in hand. What you're seeing is the first message that I hope everybody who's listening gets is that if you are boosted, you're vaccinated, you're otherwise healthy, you're really well protected against severe disease. And this is from new data against Omicron itself. But because this is a much more transmissible variant, which also seems to evade some part of our immune memory, you're going to see many more breakthrough infections, which is what we're seeing. But it's not just these breakthrough infections that are mild among vaccinated boosted are that are concerning, Hallie. The concern is that because this virus is going to cause so many more infections, it's going to find those amongst our community who are still vulnerable, you know, about 40% that are not fully vaccinated, and people who are vaccinated but in extremes of age or have immune conditions. That's about 3% of the population. And so we're at a place where those folks are still vulnerable because this is moving so fast, and every breakthrough infection is leading to potentially another person who might get infected who is vulnerable. The other bit of this is that the hospitals are already strained compared to last year, and their resilience is less because they have healthcare worker shortages over what's happened over the last year as well.
It's a good point on that. You know, you talk about how this is moving really fast. You look at the Omicron variant specifically, and it seems to have this doubling rate of every 2 days, basically. I know that Delta is obviously still an issue in this country as far as when we talk about variants. But when it comes to Omicron, what are you seeing in the data? Does it seem like people get less sick, that the illness is less severe when they are affected by Omicron as compared to Delta?
The first part of that, the transmissibility, is something we know a lot more about. We know that the odds of you getting an infection from somebody who has Omicron are 3 times that of getting an infection from someone who has had Delta. Much more transmissible. That's why the numbers are rising so quickly. We know a little less. The data is conflicting when it comes to severity. We've seen milder cases, less hospitalizations, 30% less hospitalizations in South Africa. But that's a community that's, you know, younger, and they've had many more prior infections, which may give them some resilience. UK, for example, is starting to see increase in hospitalization. So we have to hold out a bit more on the severity data. Lab data does show that, you know, the way this virus, the Omicron variant, replicates, much more concentration in the upper airway and potentially less concentration in the lungs, which may cause a severe disease. But this is all very early still, Hallie.
Dr. Bhadelia, it's important context. Thank you so much for being here and sharing your expertise. Appreciate it.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.